You're listening to Conferences Online Allergy from Children's Mercy Hospital in Kansas City, Missouri. Today is July 31st, 2023. Our topic today, jobs, contracts, and more. Our presenter is Dr. Aarti Pandya. She's an assistant professor in the section of allergy, asthma, and immunology at Children's Mercy Hospital in Kansas City, Missouri.
All right, we're going to move into our second discussion of the day, and we have Dr. Aarti Pandya, who's been very busy in the last couple weeks, also giving many other of our orientation series talks. Today, she's going to be talking about jobs, contracts, and more. I'll hand it over to you, Dr. Pandya. Thank you. You're muted currently.
Oh, sorry. I said, Dr. Miller, do you want to take a break here, or we can get started, whichever way you kind of prefer?
Yeah, it's kind of up to you. If you're ready to roll, let's just keep moving. People can,
Okay.
Stand and stretch with their cameras off. So.
Okay. All right. Sounds good. Well, for the sake of everybody's time, then I will go ahead and get started. Hi, everybody. Nice to meet you. My name's Aarti Pandya. I am here today to talk about jobs, contracts, and more. This lecture is really designed, especially for all second-year fellows kind of across the country, and also, of course, at our institution, who are in preparation for kind of looking for their big kid job now, and everything that questions that may come up, and various things that you should be mindful of when you're going into this, just so that you make sure that you're getting the best offer for everything. This is meant to be an interactive presentation, so while I'm talking, if you think of something, please feel free to just interrupt me and ask any questions along the way. Feel free to raise your hand and ask questions any which way. This is really designed to get you all, it's designed for you and to help you. So in any way that I can, we can help. So going forward, I am not an expert on this topic. Over time, just talking through, I myself going through this particular process, interviewing for both academic positions as well as private practice positions, talking to many people who have kind of have created this lecture as a result, so that, again, we can give you the best information you need for navigating, finding a job, navigating contracts once they come up, etc. So the process of finding a job and even looking for a job can be really, really overwhelming. And a lot of different questions, may come up and should come up, so that, you can kind of help navigate where best to go forward with this. So how do you wish to practice medicine would be one particular question you can ask. Do you want to practice as a hospital employee in a single specialty or multi-specialty group? Sometimes allergy practices are coupled with ENT or with, pulmonary or GI, even in private practices. So that's something to kind of be aware of. Do you want to practice within an HMO? Do you want to practice solo? If you want to practice solo, do you want to practice completely by yourself, open your own practice? Do you want to be in a practice that's owned by a private equity firm? Those are some additional things to think about. What kind of settings do you see yourself practicing in? Urgent care, outpatient, is doing inpatient consultations important to you, or do you not have any preference for any of this? And then the kind of compensation you most prefer is also going to differ. And some of this may differ in terms of when you start, your practice and then kind of go forward. But, is it more so with a salary with a production bonus, etc., bank loan if you're, opening your own practice? And then what level of compensation do you expect in your first year of practice and in your practice in general? And what's the timeline, and what are kind of the national averages for this to expect? How do you view working in a managed care environment? And then Is there a type of setting in terms of urban, suburban, rural? What type of setting do you prefer to live? And then school systems, and then just other just general geographic things to consider, such as, even your financial compensation may look different in a private practice in Kansas City versus one in Utah versus one in Florida or New York. So all of those things geographically can look different, financially can look different. And of course, your quality of your professional environment, et cetera. All of these things are important. Okay. And then some additional questions to think about. Do you prefer working in a hospital setting, again, where you have that inpatient, outpatient balance, or all ambulatory? Are there call expectations? And if so, how much or how many? Even working in a private practice outpatient setting, there are still going to be some expectation of overnight or weekend calls. So, how do you prefer to take those? And in that same light, if you're working for a private practice, they may have weekend days too, either all days or half days, etc. So what are those expectations like? Is that a rotating schedule? Is that a fixed schedule? Is that something you prefer to have, working on, a Saturday? Because we know that patients really do prefer coming on Saturdays. So you almost kind of have a strong motivation from patients' end to come, as well as shop patients to come as well. And then again, how many days of call each month are you willing to take? And then how important are job opportunities for your spouse or significant other, especially if you're both in, professional positions where, you're going to have to navigate that. That's something to think about. If there's a dual physician household, that's something else to kind of think about. So the bottom line is that answering these questions can give you a sense of what your priorities are and then what to look for in a job. So the preparation process, it's never too early to start. Everyone's different in terms of exactly when they start, but generally at the end of your first year, beginning of the second year is a good time to start because the process of finding a job and even getting a contract signed can take some time. The things that I would recommend doing include preparing and updating a CV and having an accurate CV ready to go. Writing a cover letter. The cover letter thing can be kind of different depending on, where you're at with this. So some people write individual cover letters for every single, place that they apply for. Some people have boilerplate cover letters that they have prepared. And some people have general ones for certain types of practices, like maybe private practice, and then different ones for academic practice. So it's something else to think about. Having some letters of recommendation are great because some academic positions are going to have an expectation of submitting a letter of recommendation. And when you're asking for those from, your attendings, I would always phrase it as, are you willing to write me a strong letter of recommendation in support of my future job prospect? You don't want to get stuck with a letter that's subpar when you're doing something as important as finding, a job for your future. And so knowing that someone's going to write you a strong letter of recommendation as opposed to just writing one is important. How do we look for job opportunities? So there's many different ways here. So word of mouth, of course. The college and quad both have career centers, as well as there is a list of academic, oh, actually I have this so I'll wait here to get here. There are networking events at the college, quad, etc. They even have virtual career fairs, which I believe they're having one very soon here. So keep a lookout on the websites for that because those are frequently happening. Recruiters are also a good place to, look for job opportunities. If you're bound locationally to a certain place, they may not be advertising, on the college or quad website. And so sometimes you have to cold call places directly to see if they're, hiring and if you can submit your application to that place. And then if you're highly interested in academics, there is a letter that gets circulated to leadership within fellowship programs that has academic positions throughout the country outlined. And so making sure that you're taking a look at that list again, especially if you're highly interested in staying academics, would be really good. So these are all possible ways that you can look for jobs or seek job opportunities right off the bat. How do you make yourself marketable? So if you're looking into academics, one of the things that they want to know is, what do you have to offer to the university? Is it a specific clinical expertise? What's your niche or your niche that you're offering, to the university? Is there some specific research experience? Is there administrative experience? Do you have any leadership experience that's, specific to you? Is there particular types of patients that you've encountered during your training? For instance, do you have clinical trial training from your fellowship program? Do you have specific immunology training through your, fellowship program, etc.? So this just speaks to, in general, when you are a fellow, how important it is to be involved in academic opportunities, be involved in research, join national committees, make sure you're getting yourself out there so that you have that ready on your CV when you're applying for jobs. Is there some technological expertise that you're bringing to the practice that they would want to know about? This can include anything as like hospital information systems, of course, having experience with different electronic medical records, EMRs. Is there some computer-aided instruction, image analysis, telemedicine? Specifically, you guys saw on our last telemedicine lecture, there's facilitated and non-facilitated visits. So if there's a place that has facilitated visits, do you have experience in that you can bring to the table? Is there information-based clinical applications that you have experience with, computer-assisted medical decision-making experience that you have? Anything like that is some technological expertise that you can have. Is there a broad work experience that you're bringing to the table? Meaning, have you done rotations in private practices? Have you rotated in specific specialties that you're interested in? Because different positions and different practices may have more of an adult-heavy focus or a pediatric-heavy focus. So do you have the experience from your fellowship, especially extra experience maybe, so that you are marketable for whatever the position that the practice or university is looking for? If you have if you're bilingual or if you know multiple languages, especially Spanish, that is definitely an additional way to make yourself marketable, especially in areas where this is a heavily important to have. Understanding the job hunting process and how to present yourself is certainly an important part to make yourself marketable. Your employer is going to pick up, or your prospective employer is going to pick up on your knowledge of this, and it understands what drives the employer's search, the market trends in an individual area, how an employment would potentially be a good match, mutual professional expectations, etc. And then clearly communicating why the position you are interviewing for is a good long-term career move. There is some flexibility that needs to be there with your expectations, but it shouldn't compromise, what ultimately you want at the end of the day. Meaning you try best to kind of walk that balance of, having some flexibility in your expectations, because you may not get every single thing that you're searching for, but at the same time, not compromising something that's going to affect your quality of life ultimately long-term, because you all have worked so hard to get here. You want to have a job that, makes you feel good and you're excited to be at every day. Okay, so let's talk further about CVs, resumes, cover letters, letters of recommendation, etc. So what's the difference between a resume and a curriculum vitae, or a CV? A resume is typically short. It has medical education with accomplishments written on there, but it's the shorter version, whereas a CV is the longer version. This has a detailed list of your academic and professional accomplishments in detail. If you can limit this to maximum 5 pages, that's good. It generally, if it's longer than that, even in terms of the review process of looking at it, it's going to cause some fatigue on the other end. And so making sure you have a very succinct professional CV is something so important when you're going into this process. The cover letter. So what's the purpose of this? This is telling your potential employer what you find interesting in the position that you're looking for, what you have to offer, and what kind of emphasizes your best qualities. So all of that is highlighted in your cover letter. Generally, cover letters are 1 to 2 pages maximum. And like I mentioned, for this, depending on where you're applying for, you may be writing multiple cover letters, may have a single cover letter, etc. Letters of recommendation. So not every practice is going to expect having letter of recommendations, but it's good to have in your back pocket, because sometimes when you're offered a job or you're in the process of being offered a job, they want to have a letter of recommendation um, uh, ready for you, or from you, to support your job opportunity. So generally, 2 letters of recommendation are sufficient. And the reason to ask this earlier rather than later is because sometimes the prospective job that you're looking at may have a very short turnaround time that they need those letters for. And so if you have them ready off the bat, then potentially you just have your letter writers maybe tweak the location or something like that written on the letter, and it's ready to go and submit. Once that's done, it is considered good form to write a thank you card and a personal reminder of where the letter should be sent, when they're needed, etc. So who should you ask? This is always the good, question. This is something, of course, that's you personally kind of have to introspect and think about. And some of the things that you can think about is who wrote your best evaluations? Did someone spontaneously ask you about writing a letter of recommendation for you? That's generally a very good sign that a strong supportive letter will be written on your behalf. And then again, asking would you be willing to write a supportive letter of recommendation for this practice that I'm considering for next year? That's all important to remember. Before you interview. So interviewing for jobs can, of course, take both time and money on your end. Oftentimes you have to travel to practices to interview in person. Of course, after the pandemic, a lot of this has moved virtually, but even then, sometimes you just want to check out what the practice looks like, what the people are like in person. Or sometimes the practice, of course, will have an expectation that you do have to come interview in person. So one thing that may be beneficial to you is setting up a time for a phone interview, just to get a basic understanding of the position you're interviewing for. If there's something that's a hard stop that you're just not willing to do in that particular position, then that's something you want to know right off the bat before you, again, take the time and money to travel to that location for an interview. For instance, if that practice, let's say, is a ENT allergy practice, and the type of immunotherapy that you're wanting to do is just subcutaneous. What if that practice has sublingual immunotherapy only that they're doing? That's something you want to know, or vice versa. If your familiarity is only with sublingual immunotherapy and you're not wanting to do subcutaneous immunotherapy, I can't imagine any allergy fellowship graduate not, being familiar and wanting to do subcutaneous immunotherapy. But this is just a hypothetical thing that I'm bringing up. If there's something like that in the practice that is going to be an absolute, hard stop for you, then that's something that would be nice to know off the bat from the phone, so that, again, you're not wasting your time traveling for a position that you weren't going to be interested in anyway. Deciding factors for a job vary for every individual, but potentially it could be family, friends, community, hometown versus a new experience. Some people are very locationally driven, and that could be either in terms of geographical locations or urban versus rural versus underserved. Depending on this, especially if you're looking into underserved or rural areas, there may be some loan compensation that you're eligible for. And so that's something to keep in mind when you're applying for those practices, and also something to ask for as well. But I'll kind of talk about that further later. Another deciding factor, some people know right off the bat if they want to be in an academic practice versus a private practice. So that's something that may, drive your decision in terms of where, what practice you end up being at. And then location. Do you already have a house in that area? Are you offered a job locally in the same hospital, etc.? Do you have certain financial goals that you're planning on meeting? And the job that's being offered to you, or that you're looking at, is that meeting the financial goals that you're planning on having in the future? And then lastly, the type of work environment. Is there a good collaborative environment? Are there multiple locations that you have to go to in that job if it's a private practice? If so, do you have the opportunity to interact with any colleagues, especially when you're first starting? You may have questions about how a practice is running or even patients. Do you have a ability to collaborate with others for that? Or are you kind of on your own at that point, and do you need to seek those opportunities for collaboration? So here are the major types of practices that, are highlighted here. And so the ones that, of course, we have academic. Now, academic is a really broad term, and generally when we think of this, we think of individuals who have university appointments. However, there are individuals who do teaching for those who are in fellowship, who are not necessarily in an academic setting, who may be in a health system model or in a private practice. So you don't have to be in academics, especially if like teaching, let's say you're highly interested in teaching, even research. So a lot of clinical trials are done at the private practice or health system level, or even other types of research are done at these levels too. And so it doesn't have to be an academic practice that encompasses everything that you want. But if you are looking at something that's a health system or a private practice, again, just making sure that they have what you're looking for. So with a health system model, there is you're employed essentially by the health system. Say, for instance, HCA in our area is a big health system. So your benefits may be through the health system, your malpractice, et cetera, may be covered through the health system. But that's contrasted with private practice. And now with private practice, there are a couple of caveats to this too. So the private practice may be through a hospital employment. It may be through a multi-specialty group, like I mentioned, ENT plus allergy or pulmonary plus allergy, something like that. Or there is this new thing that is coming up too, which is where a private equity firm owns a private practice that was previously maybe owned by a physician, but now has been taken over by a private equity firm. So it's important to know that. And then, of course, locum tenens is always an option. Locum tenens, you don't have necessarily something guaranteed that one specific location that you're guaranteed to go to every time. You're essentially going to wherever the locum tenens company has a need for you to go to. So if you are doing that, is there a specific location, and what radius is your expectation of travel to practice to those areas? Otherwise, are you going to have to be flying to certain areas? And is the locums practice going to cover any travel expenses that you have, any lodging expenses? Like if you have to rent an apartment to go somewhere to do a locums practice, are they going to have an apartment set up for you, or are you able to get that reimbursed? Again, all things to know. Some people have to do it out of hotel rooms. So like meaning they have to stay out of a hotel room and then, drive to a practice. So is their hotel room covered through a locum tenens practice? Some additional things to think about. How do we get compensation with a job? So when you're initially looking at a job, there are 4 main ways that you can get compensation. The first is salary. Now, salary is different depending on every single practice. It may be a fixed model. It may be a production model. If it is a fixed model and you're wanting to go towards a production model, how long is it fixed? Or is there a certain RVU expectation of how many RVUs you have to meet before you convert to a production model? Those are things that you want to know, because again, if you have certain financial goals, this is important for you to know so that you know how to plan for this long term. Is the job offering you a signing bonus? That's another way that you can get compensation from a job. Is there a relocation allowance? If you have to move, are they covering all of your moving expenses? And then lastly, is there loan repayment? We know that physicians carry a considerably higher debt than other professions with loans that we've had to take over the years. And not a lot of that we're able to pay back during our times of training. And so when you're finally at that time of signing on to a job, especially if it's in an underserved area, there may be some offering for loan repayment. So it's something to think about. All right. And then other expenses that could be covered include your licensing expenses. Where we work on the border here of Kansas and Missouri. So we are required to have both a Missouri and Kansas license, and we actually practice at both areas. I have a practice in Kansas, and then I have a practice in Missouri as well. And so I'm expected to be licensed in those areas. And so does your practice cover those licensing expenses, or are they coming out of pocket? DEA, that's another, thing you have to apply for. All physicians have to have a DEA. So is that going to be covered? And then the same thing for renewals. Is your license renewal and DEA renewal going to be covered? How about when you take your allergy boards? Is that expense going to be reimbursed? So if your fellowship covers that, that's awesome. A lot of fellowships do not cover it because the boards are taken at a time outside of the time that you were employed for fellowship. And so if that's the situation at whatever, fellowship that you're at, knowing if your practice is going to cover boards, because boards are expensive, they can be over $2,000. And when I took them, I think it was 2,650 or something like that was how much my boards cost. Is there an additional stipend? And if so, what qualifies for getting that stipend? If you're at a university practice, it's possible that you may receive bonuses for academic activities that you do, such as amounts of publications that you do, talks that you do, committees that you're a part of. And then, of course, stipends for travel as well as conference expenses. Those are additional stipends that you can have. And so the making additional revenue from things like lectures and things like doing research, that is actually, it would probably be outside of stipend. That's going to be more under a bonus category, whereas stipend would be more of, like I said, if you're going to a conference, are they covering those expenses? And then is your practice a revenue-based or a salary-based practice? And does it increase based on performance versus non-RVU based? So like I mentioned, certain academic practices that may be based on academic activities. Now, there are also university practices where your additional production is based on RVUs. So it's good to know that. And then also, is your compensation for your institution or for your practice based on the AAMC, if it's mainly a pediatric practice, or MGMA? And what do the stats look like for that in your area? What does an MGMA-based compensation look like, let's say in Connecticut versus in Kansas? Those numbers are going to differ. And that data is available through those websites for you to look at. And also whether someone goes on an MGMA-based compensation model versus AAMC is maybe based on what is the large demographic of patients that you're seeing. Is it mainly pediatric patients that you're seeing, or is it also mainly adult patients that you're seeing? If you're in a private practice, is there an infusion center that you're contracted with, or does the practice own an infusion center? If so, who owns the infusion center? Is it possible for you to become an owner or a part owner of the infusion center? Other things for you to know about as well. In private practice, in your first year, as you're building up, your patient base, you're not going to be producing at the level of your partners, and that's just a reality in terms of what it's the reality of what it's like to set up a private practice, how long it takes to build up a good patient base. It takes time, and you may be new to an area, etc. And so when that is there, oftentimes practices will do a fixed compensation for their first year. And so expectations would be, how many new patients will you be seeing? How many follow-ups? What will your templates look like? And if you are, on a fixed salary, let's say for the first couple of years, although we may think that, oh, it's obvious they're going to be paying me at some point. Different practices can have different pay models. You may not be getting a check every 2 weeks or a bank deposit every 2 weeks. It may be quarterly or something like that. And so knowing what that practice plans on doing in terms of paying you is important for you to know. Again, it helps you to know, when that money is coming in and how to plan for things going forward. And then lastly, with compensation, when are you eligible for a raise and what parameters are assessed for raise or bonus? That's just a question itself that you can ask whichever practice that you're interviewing at or applying for. So how do you determine your market value? Like I mentioned, this is going to differ depending on the location, the practice type. And so this, I think I have numbers here based on some 2021 data, but I would heavily recommend making sure that you know this data before you go interview at a place, or even if you don't know it before you interview, while you're in the process of looking at your contract and negotiating your contract with your employer or prospective employer. That's important to know so that you know what your market value is. Revenue. So in a private practice, depending on if it's completely privately owned or if it's owned by a private equity firm, who pays for the overhead is another question that will come up. And the overhead, when we use the term overhead, it's referring to essentially the office space, the light bill, the supplies, all of those things that the practice is paying for. So in some models, that is completely paid for by, whoever owns the practice solely, or whatever partners own the practice. However, if you are looking at a job that has a private equity firm that owns the practice, are they taking care of the overhead fees and things like that so that you don't have to worry about that? So what is the percentage of overhead to revenue ratio? That differs so much depending on each practice, because some practices may own their own radiology suite. They may own an infusion center. They may co-own like a Botox center that's with their allergy practice as well. So it's so different depending on what all is contributing to the revenue that's coming in. But generally, the overhead to revenue ratio is about 40 to 60%. If your prospective employer tells you that it's higher than 60%, you want to know personally where those expenses are coming from. Meaning, are they coming from out of your pocket? And if so, what are they contributing to? And how is that going to help you in the long term? That's important to know. What is the payer mix? So that is also important to know. Of course, we have many and most different private insurances. Are there any that are excluded? And if so, why? Medicaid, Medicare, HMO, does your practice take self-pay? If they do, what is the practice in terms of reimbursing those expenses? Do they charge the patients? Do they cover those expenses completely? And how does covering those expenses get managed from the practice's end? There are many different benefits to think about in terms of, when you're going forward with your job. Of course, medical. So if you're in either hospital-based practice, or if you're in a university practice, something like that, your medical insurance is likely going to be from a group practice. So you want to take a look at what those rates look like for your individual self versus a couple versus a family, especially if you plan on having a family or if you already do have a family, because sometimes it may or may not be beneficial to use your employer's benefits, or if your spouse has, medical benefits that are more cost effective. That's something to take a look at, or whoever, I said spouse theoretically, but whoever, you're covering your medical benefits through. And how often has that had turnover in the past many years? If you have medical expenses that are going to come up every year, if you're going to have to shuffle through different insurances every year, if the practice is doing, a different company for their medical benefits every year, that can be quite a hassle for you to have to go through. So it's important to know. Is dental covered? Is vision covered? If so, how much? And then retirement package. After how many years of working at the practice are you eligible? And then what is the matching for the retirement package? So there may or may not be any of this depending on, if you're in a private practice situation. So making sure you're saving up for retirement, of course, is important. But if you are in a group practice where this is part of the practice, knowing which what plans that they have for retirement, what level of contribution you should give, and again, what the matching is, and how does the matching change year after year. So some practices change their matching depending on if you've worked at the practice for 5 years, 10 years, 15, 20 years, etc. Now, tail coverage. So this is getting more at malpractice insurance. And we're going to talk a little bit about malpractice insurance. So tail coverage refers to if you were to leave a practice and someone, a patient within the practice was to come after you legally, for whatever reason, does the malpractice insurance that you have cover, a patient that is from a previous practice? Or once you leave a practice, if you keep that tail coverage, would you be covered as well? That's something to know. So I will say most university systems do provide this. It's still important to ask, and clarify with your university practice if that's ultimately the route you're going for. However, if it's private practice or if you're in a health system-based practice, if you're in a private equity firm, for sure you want to know this. Disability insurance. So there's short and long-term disability. If you are the primary earner in your home, or in your household, I should say, knowing the language of short-term disability insurance and knowing if you have own occupation short-term disability insurance is an important thing to know. This is especially important to know when you're in training, because essentially short-term disability, if something happens to you, let's say you're a proceduralist and something happens to your hand such that you're not able to operate, own occupation short-term disability, which can convert into long-term disability, guarantees a certain amount of compensation for your job if you're working in a position that doesn't pay what you were previously being paid in your other job, where you were able to do all of those skill sets. So that's where this own occupation language is really important. And the reason this is really important to look into as a trainee is because the rates for short-term disability insurance are significantly, I can't emphasize this enough, significantly cheaper for trainees compared to when you get out of practice. And so if you are the primary earner in your household and you are looking into this, I would highly think about this while you are in training. If your residency didn't, and I know now there are a lot of residencies that across the country that are setting up people with short-term disability or making sure they at least think about it or get signed up for it in their residency. But if it's something you haven't done up through now, please look around about this, ask about this. There's so many short-term disability companies that you can work with to to get that finalized. But like I said, the pay for this, the amount that it costs, is significantly cheaper from a trainee standpoint compared to when you're practicing. Is there CME benefits? Are there dictation, or do they pay for up to date? Now, I know in fellowship we kind of take for granted using for up to date, but up to date is really expensive, and so not all private practices have up to date. So if they do, it's kind of nice to know. Are there interpreter services, especially if you're practicing with a demographic that's not that has a lot of non-primary English speaking patients? Do they cover memberships like college, quad, and then, like I mentioned, paying for specialty boards? Partnership tract. So this is really relevant for private practices. Not all practices offer partnered positions. And if it's important to you to become a partner, and this is good to know off the bat, if you don't want to become a partner, it's also important to know. And if you are eligible for a partner, what kind of partner is it? Is it a partial partnership or a full partnership? How many years after working in the practice are you eligible? Or if that's not the case, if you have to buy into partnership, how much do you have to contribute to buying into the partnership? And then if you are buying out the partners that are in the practice, what is the buyout rate? And if they leave the practice, is there still some expectation of what those previous owners have in terms of compensation. For instance, in an allergy, private practice, is the shot production that's coming into the practice week after week, is that going to you as the primary partner, or is it going to the ones who have retired who previously owned the practice? Another important thing to remember. So I'm not an expert on this topic, and this is a relatively newer concept that has come up, but private equity is, I have heard so much that it's important to know about when you're applying for jobs. So essentially, private equity firms are firms that have taken acquisition of private practices when those practices were sold by individuals who owned their practices. So you can work in a practice that is not owned anymore by that previous owner, but rather it's owned by a private equity firm. And if that's the case, then the private equity firm may dictate a lot of the things for your practices, meaning how many clinics you have to have per week, how many patients have to be seen. Now, and whether or not you make production bonuses or extra money, for seeing extra patients. So it's important to know. And there may be some benefits in terms of, the marketing needs. Like I mentioned, in your first year, you're building up your entire patient practice, which can take time. So with private equity firms, they may be taking care of that for you so that right off the bat, you have a full clinic maybe going into that practice. But knowing who owns the practice and what the expectations and implications are from a private equity firm owning the practice that you're applying for is important to know. All right, now talking a little bit more in my expertise. So university appointments. If you're applying for an academic position, there are 4 key professorate terms that are important to know. 1 second, sorry. I've been talking all morning, so I don't want to start coughing or anything like that. So the first is a clinical instructor. So this is generally, it denotes the lowest amongst the 4 professor positions that are available through a university. The instructor level generally may come with a lower pay amount from the university. And another thing to kind of know about is when you're applying for academic positions is your compensation purely coming from your hospital? Like, say, for instance, I work at Children's Mercy, but my university appointment is through University of Missouri, Kansas City. So is my compensation coming purely from Children's Mercy, or is it coming from University of Missouri, Kansas City? Because that may differ depending on the hospital that you work for. And also, which system is doing my benefits? That's another thing to know. But anyway, getting back to this. So the instructor position, it's also important to know because you get promoted to these different positions: assistant professor, associate, and clinical professor, depending on if you're planning on doing this, applying for it, etc. So if you're starting at the instructor level, it already sets you back 5 years to apply for promotion to assistant professor. The vast majority of university practices will hire at a clinical assistant professor level. However, that's not every hospital. It's not every academic institution. So knowing where you get hired is important. Now, generally, you will not get hired at the associate professor or professor level unless you've already been promoted to those at a separate institution. But knowing the implications of what this means, if you are hired at the instructor level, does that have implications in terms of what your say is like in your university practice, certain positions you're eligible for, compensation? That's important to know. And then in terms of academic practices as well, generally the things that they're going to ask you are, what kind of track are you looking to do long term? Are you purely clinical? If so, you may have a heavier clinical schedule. You may have more clinics per week that you do because you are not planning on doing any education, administrative, or research opportunities. Or are you planning on doing a mixed track with clinical and education or clinical and research? If you're already coming into a place with a grant and you have a mentor who's mentoring you with the grant, like a K or a T or anything like that, that's really important for your practice to know, because you need to have protected time to utilize that grant And assuming that you are planning on doing more research in the future and applying for more national grants. And so you want to have that protected time right off the bat. Otherwise, if you don't have that protected time, you're going to be scrambling, building up your clinical practice, not getting your research off the foot, and then, being behind in terms of applying for grants in the future as well. So just knowing which track, what percentage of time that you have to do in research, teaching, clinical. Now I left off administrative on here, but administration is another route that you can take in whatever hospital system that you're looking at. And also for a lot of academic positions, you don't have to know this on day one or right when you get hired. Sometimes this may be determined after your first year of practice, first 2 years, first 5 years of practice. So just clarifying with your practice, or with your university, what that is and what that looks like. So CME, we need to do CME for multiple reasons. One, we need it when you get your board certification. You need it for your board certification. 2, you need it for your licensure. 3, of course, you just need it to stay an up-to-date physician who's up to date in terms of their practice. So all of those reasons are general reasons that we need it. But sometimes you have to pay for your CME activities, like going to conferences, doing up-to-date, etc. And so does your practice cover that, for one? And then once you're hired, making sure you're logging your CME, because you may have multiple different places that you have to log into. You may have to log into your university CME, your licensure CME, and then also, like I said, ABAI. And also if you plan on maintaining your internal medicine certification and your pediatric certification, that's important too. I'm going to try to go through the next portions quickly because I want to give some time to ask questions. So malpractice insurance, you want to know if this is covered with whichever practice that you're at. All physicians need to have, or all providers need to have it, but specifically since I'm talking to a group of physicians here, physicians need to have this. You can have both claims made as well as occurrence insurance. And the potential practice that you're looking at, you need to ask about the cost, whether that's coming out of your pocket or whether the practice is paying for it. Is it a group malpractice that you're signing up for? And is there tail coverage? How long does the tail coverage last once you leave a practice? All things important to know about. Restricted covenant is also known as a non-compete. There's a lot of talk about this. There's even this is actually being discussed on a national level, like in Congress, whether these should be legal or not in our country, but they are currently still there and potentially enforceable. So it's important for you to know about. Essentially, this is referred to a non-compete, and it's an agreement between you and your employer about your ability to compete with the practice with seeing patients once you leave that practice. So your restrictive covenant may be different in terms of the length of time it applies for, the patient demographic it applies for, adult versus pediatric, allergy versus all patients, etc. The radius in which it's enforceable, 25 miles outside of your primary location or any location that's within that your practice owns. And the contract will list how far it applies for in terms of distance, time period, types of patients. So if this is really important to you, and the covenant is really restrictive, make sure that you're discussing this with a legal mind so that you know exactly what you're getting into when you're signing your contract. I think we talked quite a bit about this. I'm going to move on from this. And then I mentioned this, some practices may have their own imaging. If so, who reads the x-ray? Are you reading the x-rays or are you sending them off to a radiologist? And is there a radiology fee? Some practices do not want to send their films outside of their practice because they have to charge a fee for a radiologist to read it. But then are you willing to take the liability for reading that imaging? That's another thing to know. Allergy shots and infusions. So things to know: who's doing the skin testing? Is it an MA? Is it a CA? Is it a LPN? Is it an RN? For shots, shots can be pre-made mixes, or they can be custom made based on skin testing. So are patients placed on shots with negative skin testing? There are practices that do that. Are you comfortable doing that after your fellowship and after everything you've learned about with regards to immunotherapy? Who is doing the mixing? Is the mixing USP 797 compliant? Who's administering the shots? Does the practice allow for home shots? Is SLIT something you're doing? And is SLIT the FDA approved product or products, or are you using the extracts from your company to custom make the SLIT? All important things to know. What are shot hours and schedules? That's important things to know as well. And then infusions, does the practice only do IV versus sub-Q? Is there an in-house infusion center? And do you get privileges at local infusion centers or not? Who assists with those orders and lab follow-ups? Biologics in terms of PAs are extremely important to know who as your support staff is going to help you with the paperwork, because as you know, this is quite extensive paperwork you have to do for those. And then knowing what your staff setup is like. Do you have additional allergists? Do you have other subspecialists? Do you have rotators, nurse ratio, adult to patient? Is there an office manager? Do you have an opportunity to meet the office manager? Is there a billing manager? And do you have an opportunity to meet them? Who does the check-in process? Can clinic staff put in orders for you? Is there a scribe who can write the notes for you? Who's doing prior auths? Is there anticipated turnover of the staff? And who sees same-day patients? So HR may be responsible for the billing, or it may be private, depending on a billing manager, for a private practice. How do you calculate productivity? Who does the billing and how often is this reviewed? Is there an EMR system? If so, which one? Is there appropriate training to get you, trained for that? Is the practice paper-based? If so, are they filing a fee to the government every year for not having an electronic medical records? And if they are, where is that money coming out of? Is that coming out of production or from the practice? Where is that additional money coming out of? And is there a different EMR for prescriptions versus clinical documentation? Are there journal clubs? I'm not an expert on visas, and I know very little about it. I think in the future, when I have some opportunity to talk to other people about this, I may have more information about it. I do apologize for anybody who does have a visa that I can't get you additional information on this. I know there's many different types, and individuals who have this are probably even more knowledgeable than me about it, because you have to have full knowledge about this going into any jobs that you have. Consulting for pharmaceuticals is also a little bit out of my expertise, but this is something that you can do adjunctive with your job or, as a primary job. So we assume that most jobs that we take are going to have some clinical basis, but this is a little bit of a non-clinical position that one can take. Making sure all of this is reviewed in terms of your contract, the non-compete, malpractice, compensation, termination rules, capitation payments, and different individuals may review it with the lawyer. If your program director is the savvy legal mind, you can have them review it. All important to know. And then in terms of the contracts, you may have certain parts of the contracts that can be changed and that may not be changed. If you receive an offer letter from an academic institution or even from a private practice, before you sign it, you want to make sure you know whether that is what you can negotiate everything into. Is that where you're negotiating your schedule into, your compensation into? And then also, don't trust anything if it's not written in words. Don't trust anything based on, something that was said in an email or said by mouth. If it's not in the contract, it doesn't exist. So if there's something important to you, make sure it gets written down in the contract. So in terms of negotiation, making sure you ask once you've been offered the position, if there's something important to you, you should not be afraid to ask. And many new faculty are afraid to ask because we feel like, oh, we just need to take the first thing that comes to us and not argue. But if there's something important to you, make sure you're asking for it. And in terms of your negotiation skills, prioritizing first what you want to negotiate, put it in writing, and then have a discussion with your prospective employer about it. Other considerations are your referral base, whether you're supervising NPs, work schedule. Is there a parental leave policy? Is there an albuterol prednisone refill policy? And then again, if there is a parental leave policy, do you need disability for this? And then just general things for before you begin your practice, adapt a style, contact your mentors, prepare your smart phases. Yeah. So I have very little time, but I would like to open up to any questions because I know this is a really important thing. Well, Dr. Miller, do we have time for any questions?
Yeah, we'll go ahead, and if people need to run, I get it, but at least we're not going to have other conflicts. So, hey, I did want to mention a couple things. You mentioned about contracts sometimes aren't negotiable as far as the written part of it here, and you're absolutely correct. And many big employers, big facilities, they have a boilerplate that it just basically is the standard. However, it's not uncommon if there is a negotiation, whether it be a contract bump or a certain time off, whatever. A lot of times they'll put that in kind of like the cover letter and
Yes.
add little minor changes to that part too.
Absolutely. I cannot highlight more what Dr. Miller just said. Before you sign your cover letter, make sure that is reviewed. And if that's what's, the part of negotiation, make sure that's reviewed. I think we have a question here from Sana. How do you answer when a potential employer, I'm assuming, asks what compensation you're looking for? That's where you need to do your homework. Make sure you review the MGMA and AAMC stats before you go to that interview. And if that's not something you want to discuss in the initial interview, you can, punt that off for a further discussion, once you receive the contract. But if it's something that is being pressured for you to ask in the moment, you can list off a number based on the stats in your area. You can go on the higher end of that. You can go right in the middle, whatever you feel comfortable with. It doesn't hurt to ask for more. The worst that's going to happen is that you're just given a little bit less, but it doesn't hurt to ask for more. Good question.
Yeah. And when it does come to contract or salary negotiation, it's kind of like when you go in to buy a car, they're going to say, how much do you want to spend? Because they know they can work your loan out for 4, 5, 6, 7, whatever years, right? And you kind of don't want to give that up, but you also have to have knowledge of what's reasonable too. I've done my best always not to give a specific number and dance around it. Just like they don't want to talk money up front, you probably
Right.
shouldn't or don't want to. It's okay. And said, the salary is a very important part of this. However, I need to look at the bigger part, which is this the right fit for me and what my duties are and expectations and how can I help? And is this the right town? So you can kind of dance around it and kind of save it until you get a better feel of, is this the right place for you to do that? And then going in armed with knowing kind of what the salary ranges are for starting out in that area of the country. It's not a simple, easy find, but if you do enough digging, you'll find reports that are relatively recent that give you some ideas on it. When it comes to academic, there's but 2 or 3 different systems that look at it. Allergists are at a distinct disadvantage because we're one of the few subspecialties that work in private practice, where we tend to be fairly well compensated. But when you go to the academic side, it's different, and the billing and RVU and how they count all that. So in the academic world, it gets a little dicey. But anyway, I want to open it up for any other questions from the audience today.
Yep, and I think we have another one. Would you have an employment lawyer look at a contract before you sign it? Oh, this is a tricky question. I'm going to answer it the best that I can. That depends on what you want to do at the end of the day. Some people come into this already having a higher level of knowledge about the law and contract law, I should say specifically, or they have contacts who have a legal eye that can look at this. However, if it's your first job and you don't feel comfortable looking, on your own, then certain people do employ lawyers to look at it. Now, you do have to pay for that. So what is the lawyer, charging you? Is it a fixed fee? Is it amount of hours based on, what they have to review, et cetera? So knowing how much the lawyer is going to charge right off the bat is important. And remember that just because you hire a lawyer, that doesn't mean that they can negotiate everything for you or even do everything for you. While it's possible for them to speak on your behalf for negotiations, most of the time in our world, I will tell you all, transparently, we do the negotiations on our own. And whether or not you get what you're asking for in your negotiations is not guaranteed. And so that's where it gets tricky. Some people really prefer this. Some people do not prefer it. And I know if I were to pool like my 10 allergist friends, including myself, maybe half of us have had a lawyer who's reviewed our contract and half of us did not. So I apologize, that's not a perfect answer, but it really just, it does depend. Talk to if you're able to talk to your attendings in your practice about it, they're an excellent source of knowledge about this, because likely they will have had experience with this as well.
I will throw out something on tail insurance to be very informed of what you're walking into. I don't know what the rate of turnover in the first few years, but I know by some of our fellows, they've gone somewhere 2 years later, they moved to a different place. And they're probably having to pick up some tail insurance. And it's hard to think that you're going to pay for X number of years down the road to cover for a job that you weren't really happy with and moved on. And you're not getting any more income from that group, but you're having to pay for an insurance for the past exposure that you had liability wise. Offline, I'll talk to our fellows sometime about tail insurance. The state of Kansas has a very unique situation, but we'll take care of that offline. So.
That's a good point, Dr. Miller. The place you end up employed at, like the state you end up, may have different requirements or laws for malpractice or tail insurance. So make sure you're familiar with that.
Definitely. All right. Any other questions from the group? Okay. I will point out Dr. Sirota was kind enough to share his email address. It's in the chat. So if everybody goes to the chat real quickly, you can grab that. If you had any great derm allergy questions, he's a fantastic resource. Okay. Well, I don't think we have any other questions. Dr. Pandya, thanks for sharing your knowledge on contracts and jobs and more. Wish I would have had this 25 years ago. It was interesting in those days, but that's for another story. But for our second years, this is the time to get busy and get the letters out and then start thinking of how you're going to do this. Do remember to take a lot of information down, mainly if you're interviewing at many different places, because it'll all run together. So write everything you can down after the interview so you have some fresh knowledge, and then go back if you have more questions. Because I think if you are asking the questions on things that were explored today, I think your employers can go, oh, we've got somebody who's kind of business savvy, right? Mm-hmm. And they want to see that, because in the end, for a lot of these people, it is a business. I'd like to think it's more of a calling, but it is a business in the end. You got to pay bills. So asking those questions, I think that they're going to be more in your favor when you do that, compared to, worried about, are you trying to get into the business side too early? So.
Have these discussions. Don't be afraid to ask questions is like my biggest takeaway, because I think a lot of people get afraid about talking about this stuff, but it's really important for us as physicians to be armed with this knowledge.
Exactly. All right, we're going to go ahead and wrap up COLA. Dr. Lee, I think you're going to take the recording offline there, and we can talk later about if you know where to post it or not. But anyway, Dr. Pandya, thanks again for being here. Thanks everybody for the listening audience, and we'll see you on Friday.